This relationship, and he ended up working with his business partner in our office for a number of years. We have become friends, and our conversations are the widest ranging of anybody here at Rocky Talk. So if you see Schaefer and I sitting next to each other in the Sun Sphere tonight, I will guarantee you cannot predict what we are talking about. Last night I saw Schaefer was hosting some sort of pop culture draft up at Bobby Nat's porch. They're drafting, I don't know, he's like, I'll take Dr. Dre. And so it's like, ooh, great pick. I have no idea what they're drafting. Anyway, Schaefer's been obsessed with healthcare and really the payment side for a very, very long time. He has started multiple businesses in order to try to fix the healthcare system. Spoiler alert, doesn't he's as optimistic as he used to be. And hopefully, I told him that I would make the doctors go first so that you could ultimately feel nice and warm about what's going on in the medical community before Schaefer comes and tears the entire thing down. So with that, come on up, Mr. Schaefer, welcome. Yeah.
So this is a sensible state. We've got patients over on the left, they're risk averse. We've got insurance companies in the middle, they're willing to take on risk. And then you have providers. And we're going to group hospitals, emergency service, stand-up radiology, all of that will be providers. They're on the far right, they're looking for some business. Let's throw some numbers on there. 1 in 5 chance of an emergency. We certainly hope that risk is not that high, but for the sake of this, we'll go with 20% chance. The insurance company that's willing to take on this risk is going to charge a premium. That premium will be directly related to the underlying cost of the services. So the insurance company goes over the 3 providers and says, hey, who here has the best quality? Who here has the best price? Who here is the most convenient? They vet them all. They decide to only go with one, the top provider. $5,000 in the case of an emergency. The insurance company would set the premium at $1,000 if they were breaking even. They tack on 15% for profit. $1,150. Everybody is happy here. Provider getting business, patients getting coverage, insurance company making a little profit. Now it's easy to look at that 15% and say, oh my God, what are they doing for this? But consider that that negotiation is vitally important. If there was just a single patient going to the provider wouldn't have that great of an incentive to reduce prices, because I'm only getting one patient. But if you bring the buying power of all 5, all right, I might bring those prices down, and then to process the claims and everything that goes into it. So we've got a sensible state. It is sensible because no one actually wants to use insurance. Consider all other forms of insurance. It's for disasters, for uncertain, catastrophic things. You don't want to use insurance. You do it because you're risk averse. That's sensible. Now the trouble begins. Well, those patients aren't just happy with only one provider. I heard that middle provider's got slightly better quality. And the third provider has a more convenient location. So we want all of them covered. Okay, the insurance companies goes back to negotiate. By definition, the premium has to go up because of the thing that I didn't tell you in the previous state. The insurance company brought in the least expensive provider, $5,000 for an emergency. These other providers, we'll just make it up, middle one $7,000 for an emergency, the bottom one $6,000 for an emergency. There is greater than a 0% chance that in the case of an emergency, someone will go to one of the other 2 providers. And since we're just pricing it based on the underlying cost of the good, that good now costs more than $5,000 on average, premium goes up. The other thing that's driving the increased premium, if I'm that provider, why am I offering such a good deal? I'm that top provider. In the sensible state, I get access to all 5 patients. I've crowded out the competition. I won this bidding process with the insurance company. I get everybody. Now, I've got to split the 5 patients with the other providers. My incentive to have that lower price is no longer as great. I'm not getting all of the volume. Trouble continues. This is really the state where we shift from insurance to something that is not really insurance. Because we're using insurance to buy something that we're already buying. The patient's like, yeah, the emergency coverage is nice, but I'm going to the doctor. I'm getting checkups, I'm getting other services, my kid goes in. That would be great if I could get that covered as well. Insurance company says, all right, sure, we'll do that. Why will they do that? Because the premium can go up. Premium has to go up. Premium is directly related to the underlying cost of the goods being purchased with the insurance, and now there's more goods being purchased. Forced coverage, so well-intentioned. Government comes out and says, hey, these shots, they're incredible. We need every insurance company to cover these shots. Again, this story is never about bad intentions. We've got a lot of people, those doctors, great people, look at them. They want you to be healthy. This is about the system and the incentives. They're just perverse enough to keep the system broken. So the insurance company says, sure, I'll throw this on there. And they will especially say yes to this because it's not a competitive disadvantage. You've got insurance company A, you've got insurance company B. They might have differentiated themselves in the services that they covered. But now they're forced to cover the same thing. Everyone's got to cover the shots. Premium goes up. Now, maybe someone out here is like, well, part of the intention there was that those shots were going to lower the cost of care. Preventative medicine, 500 peer-reviewed studies, 2 things that actually save cost. Childhood immunizations and recommending low-dose aspirin to adults. Everything else, there is value from preventative medicine, it just doesn't save any money. Insurance, no longer insurance, it's a payment mechanism. We're using it to buy things we were already going to buy. We're using it to buy things we know we're going to have to buy. No uncertainty. Homeowners insurance, uncertainty. Maybe the house burns down. Not in the state that we have here. And to this point that we alluded to before, there just isn't enough incentive for anyone to really want to control costs. Let's go through the various players. Patients. Cost is way too indirect for them to care about. Here's the example. You've seen the story on the news, in the newspaper. Oh my God, there's a $100,000 bill. This is terrible. Oh my God, healthcare costs are the leading cause of bankruptcy in America. Good thing I don't have to pay for that. Wow, $100,000 bill. Insurance pays $50,000. I paid $50 for a copay. Incredible that I don't have to pay for that. Who else would be paying for it but you? You are paying for it. It's just indirect enough that it doesn't feel that way. It just comes out of your wages. Employer says, I'm going to pay you $100,000 in compensation. Could be all wages, but because of the way the tax system is set up, we're going to give you health insurance to 100 million, 80 million people that way. So it's taken out of your paycheck, not direct enough. Taken out via taxes. You want then everything to be covered. This makes so much sense given what we just said. It feels like you're never paying for anything. It's starting to, and we'll get to that point about the deductibles. But it's just in this weird world where I pay like these little amounts, but I don't really pay for it, so cover everything. Sure, give me those shots. Give me the extra checkups. Because if someone else is paying for it, I want more stuff covered. Last thing, you're not actually incented to make cost-effective decisions. Even with the rising deductibles, and for those individuals, you've got a $5,000 deductible, maybe I'd like to save some money, though we've seen the patients don't respond to those incentives enough, though it is a way to get costs down a little bit. The problem is that the real cost of the system are the people who are going through their deductible in month 1. You need a Remicade infusion, $20,000 at a hospital. You're going to get that 7 to 9 times a year. If you got it at your home, it would be $5,000. If you're a patient, why would you choose the $5,000? It's above your deductible. What do you care? You don't even know the price. So you go and get that which is most convenient for you. If it was like car insurance, you might behave a little bit differently. Think about the time when you've had the car accident and you have to debate, should I use my insurance? Because you know if you use it, then your premium's going to go up. It's directly related to your behavior. Health insurance is priced based on the community. It's based on all of us. So if you go and get that Remicade infusion for $20,000, it's not like you see a direct relation then in the uptick of your premium. Your premium is being affected by so many things that you cannot control, namely everyone else in this room. So why not? The providers, very high approval rating. They should, again, we saw them, great people doing great work. But they respond to incentives. And as we said, we're talking about all providers here. A lot of this is driven by hospitals that are becoming increasingly powerful. Profit motive. Not a bad thing. Don't fault anyone for trying to make money. All I ask is that we look at providers in the same way we look at a Wall Street banker. Wall Street banker wants his or her clients to have very robust 401ks and would also like an extra house in the Hamptons or a Ferrari. Nothing wrong with this. This is what drives incredible innovation, drives incredible progress. We have somehow missed that that is also what is driving decisions from providers. That is one of the reasons that we could actually encourage monopolies. It sounds so good. I'll pitch it to you right now. You'll love this idea. This is what our country has been pitched, and we bought in because it sounds so seductive. We're going to have a hospital that then will buy up all the general practitioners, then buy up all the stand-alone radiology facilities, and buy up all the different types of specialists. And now your care is going to be less fragmented. That system that you hate, it's going to be better. It's going to be more efficient and prices will come down. Why would the prices come down? You now have monopoly pricing power. You now own everything in an area. Since when has anyone gotten that type of power to reduce prices? They don't. And again, not faulting them for it, but just following the incentives. They also don't really have to compete. Yes, there is still competition. I'm sure if there are providers here, they're like, oh my God, I have tons of competition. I've got these people who are outside the hospital and they're trying to beat me out. And so yes, it's not perfectly that they don't have to compete. But in many major ways they don't. Namely, that everybody wants every provider in. Go back to the previous slide. I want my doctor in. I want my hospital in. You go to any major area, 95+% of the providers are in every single insurance plan. Every single insurance plan. So in that long ago sensible state where that insurance company was able to hold the providers accountable in a different way, namely on the cost of care, they can no longer do that because every single provider is in. The insurance companies. These are the companies we hate. And yes, they, like everyone, part of the issue. A thing that's not often believed because we like to tell the story that insurance companies are all about denying things. They actually drive revenue through higher costs. Some of their plans are even regulated such that they cannot make more than 15% profit. So they take in $100. They can only make $15 to keep for their admin costs off that. Which sounds like a good idea, maybe, until you think about it. If you're running that insurance company, would you rather have costs at $100 or at $1,000? You get to keep 15% in both circumstances. I'm taking the $1,000. They've also lost negotiating leverage for the reasons we explained before. The patients need everybody in. How do you push someone into negotiation if you have no walkaway power? It's very challenging. They also don't have to really compete on product design. Part of that are the government mandates. You have to cover all of these things. Why should I go with insurance company B over insurance company A? Insurance company B has all of the same providers in it, and they have the exact same product design. Last thing, government. Maybe the government will bail us out. And there are some ways where they could. Again, while I'm painting a generally negative picture, there are certain ways these things could be different. I'm not optimistic. The government cannot say no to anything. Our congressman actually alluded to this. We're concerned with re-elections. And what gets us re-elected? Yes, you can have that drug. Yes, that service is covered. Yes, 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 yes. They will talk big game. We all will. Providers will, patients will. We want to control costs. Tell me why exactly you want to control costs, especially from the government perspective. Costs, excess, bloat, waste, these all sound like bad words. It is revenue and jobs. Oh my God, these hospitals, they have to have so many people dealing with billing, and yes, it's very annoying, and there is a way that it could be more efficient. What would happen if it was more efficient? Those people wouldn't have jobs anymore. Oh my God, these doctors, they're doing these unnecessary tests, these unnecessary scans. What would happen if they didn't? Revenues would go down. Tell me a government official that can stand up in front of that type of pressure and say, yes, cut that stuff. Put those people on the street, reduce salaries. Can't take on providers for fear of losing votes. The government's actually negotiated very good prices. Medicare, fantastic negotiation on prices. Medicaid, even better. Good luck pushing that any further. Look no further than the previous Democratic, last week, the Democratic debates. You will take on drug companies are evil. You will take on insurance companies are evil. Does anyone ever mention providers? You do not want to take on providers. Last thing, you can't stop fraud. Bernie will tell us how low the admin costs are. And yes, the headline number of admin costs, pretty low. Some things that it doesn't take into account, many services are outsourced to private companies. That actually increases the total admin cost. And some 10 to 30% of Medicare is fraud. So I could run a bank and say, well, I've got very low security costs. I don't have any guards. I have just, the doors are open 24/7. Really low security costs. But yes, tons of money is being taken. I want your admin costs to be high. So this is all very pessimistic. I know we're here on a holiday. God, is there anything good? Can we say anything positive? Healthcare is not health. Oh. Any research that has been done on this topic will say that no more than 20% of what contributes to you being healthy, to you living a long life, comes from access to the healthcare system, yet that is where 100% of the conversation is occurring. That is great for the biggest of big businesses, healthcare, the providers, the insurance companies, everyone else in the system, but it's not really that good for you. Third leading cause of death in America, medical error. We are freaking out about guns right now. There's 35,000 gun deaths that occur each year. There's 250,000 deaths that occur because of medical error, and we want more of it. Perhaps we should reconsider. Perhaps we should think about the side effects that occur every time we take a drug. I am not some hippie who is out here that is saying, oh, just live off of grass. Medicine has done fantastic things for all of us. We've extended life, we've extended well-being. But with that said, it's not the only or primary reason why you will live a happy, healthy, successful life. And I think that if we spent more time considering those things, that's our best path to solving the healthcare crisis. Thank you.